Welcome to the blood culture collection review. My intent for this review was to help our ED staff decrease the contamination rates related to blood culture collection. In our department, we are averaging month to month about 1 to 3% contamination rate. And although we are the department with the most amount of draws, we should have a contamination rate of less than 0.5%. Having a contaminated specimen adds thousands and thousands of dollars, probably averaging around $15,000 per patient with a contaminated specimen, because what that entails is an increased length of stay, repeated blood cultures, so the patient needs to get stuck more times. There's antibiotics that need to be changed. The laboratory has to run additional testing. So we want to try to decrease this problem. I have invited a representative from BD who is the company that supplies our blood culture bottles. Okay, so I have Brenda Eaton here from BD, and she came to go over blood cultures and to help us possibly bring down our contamination rates with our process. So thank you for coming.
You're very welcome.
So can you talk about how we should be prepping the skin ideally for the least contamination?
Yes. It's very important that we use good aseptic technique to collect a blood culture specimen, because if we introduce bacteria into the bottles from our skin or the patient's skin while we're collecting the sample, it's really a problem because the organisms will grow in the bottles, and it very much looks like that organism is in the patient's bloodstream. So what we're trying to do is focus on the aseptic technique to collect the specimen without introducing any bacteria into the sample from the skin, and that way anything that grows in the bottle will truly be in the patient's bloodstream. So the best thing to do is to identify your venipuncture site first and then apply the chemical that is meant to kill bacteria on the surface of the skin and also slightly below the surface. So how it works is called chlorhexidine gluconate with isopropyl alcohol. And the isopropyl alcohol is there to assist with the drying time, but really the chlorhexidine is the chemical that kills bacteria. But it does require some contact time. So if you identify the venipuncture site first, the vein that you're going to obtain the sample from, using gloves, and then apply the ChlorPrep, and you have to use a little bit of a scrubbing motion, back and forth, because what that does is it removes dirt and oil and any dead skin cells from the surface of the skin to allow the chlorhexidine to penetrate a little bit. It soaks in a little bit below the surface of the skin so that when we introduce the needle through the skin, we're not going to pick up any staph or other type of skin flora that might be there, and then it would get into the sample. So it requires 30 seconds of contact time to kill bacteria, or it takes about that same amount of time to dry. So oftentimes we say apply the chlorhexidine and allow it to dry for 30 seconds, which you're really allowing it to dry so that it has enough time to kill the bacteria, which is 30 seconds. So 30 seconds is what you want to remember. After you do your back and forth motion for somewhere between 15 to 30 seconds, allow it 30 seconds of contact time, and while it's drying, you could plan the order in which you do things to clean the site first, and then to go back to prepare your bottles, your butterfly of choice connected to the needle holder, and organize your tubes and get everything handy, Band-Aid, gauze, everything at the bedside that you'll need. And then when you go back to insert the needle, you want to try your best to avoid touching the vein again, because now it's a sterile site. So if you can do that, that's really the best practice, to just go ahead and insert the needle into the vein. And the bottles do have a vacuum in them, but they do not stop filling on their own. So it's very important for everyone to know that it's going to draw the volume of blood that it needs, but you have to eyeball it or observe while it's filling and stop it yourself by removing the bottle from the needle and then switch to the other bottle. And then you can follow that with any other tubes of blood work that you need to do.
So how much should we be filling each bottle?
Okay, so the optimal volume for each bottle is 8 to 10 mLs. It's written right on the bottle in red in a little bit large print. 8 to 10 mLs is optimal volume for a blood culture sample for each bottle. And then there is a range of 3 to 10, just so everyone knows that the minimum you want to try to collect is 3 cc's, but the maximum is 10 mLs, and it just improves recovery. The more blood you draw, the better chance we have of getting a positive blood culture, because the bacteria is very dilute in the bloodstream. So if we draw a larger sample, it's just going to improve my chances of catching an organism as it's floating by in the vein.
So just to clarify, these bottles are different than our lab vacutainers, our gold tops and our purple tops.
Yes, vacutainer tubes are completely evacuated, and which means that we can manufacture them so that they will pull in a certain amount of cc's of blood, and then they will stop when the optimal volume is obtained to mix in with the additive in the tube. But the blood cultures are different because they're kind of big in size, because they have a gas supply in them for the bacteria. They're almost like little mini incubators. So when the blood sample goes in here, there's enough gas supply for the bacteria to grow for 5 days while these bottles are in the instrument in the laboratory. So because of that gas supply that the bacteria need, the bottles are not completely evacuated like the tubes are. There's sort of vacuum, but then there's gas supply, so we have to, they're not what we would call a direct draw or like a control draw, where they don't have the ability to stop filling on their own. So because of that, we have to use some techniques to observe while it's filling, by marking the vial, using the hash marks that are on the side of the label in 5 ml increments, and then observe while it's filling and stop it ourselves.
Okay, and our lab is nice enough to put the sticker for us so that we don't overfill, because that is a problem as well if we have more than 10 mLs.
Yes, the nutrients broth in the bottle with anticoagulant is optimized for a 10 ml specimen. So that means that if you draw more than 10, there's really not enough nutrients and not enough anticoagulant for that large of a sample. So the blood to media ratio is really important for a blood culture. So we really do have to know that there's a minimum of 3, but there's also a maximum of 10 cc's that should go into the bottles.
Okay. And what would you recommend for if you have a difficult venipuncture, if you had to repalpate? So now we're concerned about contaminating the skin again. What would you recommend?
Well, the best practice is not to touch the vein again at all after the chlorhexidine has dried for 30 seconds. But if you did have to retouch it, you have a couple of options you could do. One is to change gloves to a completely new pair. You could clean the finger off that you're going to palpate with alcohol prep, or you can touch the venipuncture site again, but you would have to re-cleanse the skin again and let it dry for another 30 seconds. So I think that would just be up to you which would be the easiest of the 3 options to do at the bedside.
Okay. Can you just remind us as to the order of drawing the culture bottles?
Yes. The best practice is after the aseptic technique, when everything's ready to go, the first blood bottle you should draw is the blue top, which is the aerobic media. It has a gray plastic top, but when you flip it off, it's blue underneath, and that's the aerobic bottle, and the anaerobic bottle is the purple color, so that should be the second one that you draw, and then you should follow that with any other Vacutainer or tubes that you need to collect on the patient.
Okay. And what is the best way to put our patient label after we've done our two identifiers? What is the best way to place it on the bottle?
Yes, the bottle, once you draw the blood in there, there's really no part of the bottle that the laboratory really needs to be able to see. So there's a barcode on the label, though, that the machine reads for the automation. So when you place patient labels on, we just recommend the opposite side of the bottle to place stick-on labels lengthwise in rather than wrapped around on top of the barcode that's on the bottle. So really just anywhere except for on top of the barcode is perfectly fine.
Okay, so we are concerned about contaminating the specimen after we have taken it off the vacutainer. Can you explain to us a little bit about what happens once we put the put the culture bottles in our tube system, and what happens as far as what happens in the lab and how do they run the results?
Yes, after the specimen is collected, and we do just want to mention that when you flip the little plastic tops off, it reveals the rubber stopper, and you do want to use a sterile alcohol prep to wipe the two rubber stoppers off. You could use one for both if you squeeze it and just give it a good scrub and give it some time to dry, or you can use one for each bottle and just leave the pad sitting on top of the bottle while they're at the bedside. And that's only really if you have a place to set them down, though, that will work out. But after the blood specimen is introduced into the bottles, they could be packaged up in either a bag or the protective container that's meant for the pneumatic tube system. And they really are not, there's no more needles that are ever introduced into the bottle from that point forward. What happens is that the bottles are ready to go once you collect the blood, and they go into a machine, which is an incubator, and they lay on their side, but the instrument reads for growth of bacteria right through the bottom of the bottle. So there's really no time where any more contaminants can be introduced into the bottles other than when the sample is collected. So if there is any skin flora introduced into the bottles, which as a result is a contaminated culture, that's done during the collection and not during the transportation to the laboratory.
How important are the blood cultures in the emergency department?
From my experience working in the microbiology lab, what happens with the blood cultures that are drawn in the emergency department is that oftentimes the patient comes in to the emergency room and the blood culture is collected, and then typically after that some treatment is started and the patient may be admitted to the hospital, and then more blood cultures are collected once they're admitted, but oftentimes because they've already been on antibiotics for a day or two now, the only positive blood culture with the important diagnostic information in it is that initial one that was collected in the ER. So it's really the most useful information for diagnosing what may be causing the patient's symptoms. The initial blood cultures that are collected in the ER are the most important ones really for diagnosing the patient correctly, because once they're started on therapy, then oftentimes the additional ones that are collected don't really come up positive. So that's why I wanted to emphasize the sterile technique, which they're collected in the emergency department, is very, very important to keep in mind for that reason.
Great, thank you. I think these hints will definitely help our staff have less contaminants.
Great.
Great, thank you.